Duchenne muscular dystrophy, or DMD as we call it, is a terribly unfair disease. It affects young boys, it steals their muscles, their strength, their independence, and ultimately their lives.
Genes consist of exons and introns. Exons are the important bits that have to be joined together, and they're joined together in a process called splicing. Now, what happens in a genetic disease like muscular dystrophy is that there's a spelling error in one of those exons. There's a signal that says stop, so the gene message is only part read. What we've come up with is a way to trick the splicing machinery, process that joins all the exons together, to snip out the disease-causing part, to skip over it. It's almost like a genetic whiteout. So instead of getting a message that stops partway through and causes severe disease, we get the entire message but missing a tiny block in the middle.
Over the 20 odd years that we worked on this disease, we designed drugs to address mutations across the entire gene. It's a huge gene. So this work was initiated at what was then the Australian Neuromuscular Research Institute, that has morphed into the Perrin Institute. At the time, we were UWA researchers. The drugs that we designed were licensed by UWA to Sarepta Therapeutics.
The 3 drugs that are approved by the FDA for muscular dystrophy, they're all targeting different parts of the dystrophin gene, because this is a big gene, 79 exons, and the spelling errors occur in different parts of the gene. So we don't have one drug that treats everyone. We have to tailor the drug for the mutation.
These 3 are probably treating over 30%. So that is absolutely huge. But it is a treatment, it's not a cure.
I met Terry, Billy's mother, a number of years ago in Pittsburgh, and he's become one of the poster child, one of the fantastic responders for this.
When Billy started his treatment, when he joined the clinical trial, he was having difficulty walking. He had a manual wheelchair. He walked with difficulty, but he could walk. The big difference is he's continued to walk. Billy would have been expected to stop walking well within the next 2 years. This was 10 years ago.
When you can see a difference, a boy can't get into a car without assistance. And then after he's been on the drug for a few months, he can struggle in, and a few months later, he jumps into the car. We were never expecting to see improvements like this, or great benefits. We expected this to stabilise the disease. But we're seeing situations where kids are getting marginally better. It brings a lump to your throat. It's why you do medical research, is to try and make a difference.
Discovery is a really exciting thing. Discovering new things, answering questions. But at the back of all of this is the fact that there are patients and their families out there who need treatments.
So I'm hoping this will be almost a new type of technology. And if we can use it for rare diseases, or some rare diseases, you can use it for an antiviral, you can use it to dampen an asthma infection. What I'm particularly excited about is how this can be used for more common diseases. Asthma, Alzheimer's, diabetes, Parkinson's. So it's exciting times, and the ability to target and look at so many different conditions using a common technology is very, very exciting.